So let's maybe just give you some information. So the long and the short of it is that the Hand Mentor is, and the Foot Mentor for that matter, both of these are robotic exoskeleton-based systems that have been shown to help improve upper extremity and lower extremity function. Yep. And they are, the robotics sounds a little bit complex, but it's really fundamentally a series of sensors that go on your arm, kind of in a sleeve, that help to detect that movement and translate that into kind of a virtual gaming environment that you can then interact with. Right. And that's what allows you to engage in that sort of high dose repetitive task practice and make it a bit more palatable, make it a bit more fun. Mm-hmm. And so that's one side of it. But the other side that's really, really important is it also has this idea of assistance where there is basically a muscle on board of both of the devices, both the Hand Mentor and the Foot Mentor, that can help you initiate movement if you do have that difficulty. And that can provide as much as all of that movement that's required by someone to gain those motions. And the really interesting thing about this is that it can actually accommodate your varying levels of needs, or in this case, your mom's varying level of needs as she progresses, right? Because she's in the sort of subacute phase where things can change pretty quickly. And I'm sure you've already experienced that with some things improving. And so having the ability to, what I like to call dynamically assist over time is really, really important. So maybe right now she doesn't have the ability to volitionally move, but she could also maybe start to regain that as she starts to recover in these next few months. So something like this could be incorporated to work with her physical therapist or hopefully future occupational therapist as well, to hopefully get her more rehab, that more dose.
Absolutely.
We know that's sort of a fundamental driver of long-term outcomes. And so anything you guys can do to kind of really maximize that is going to be helpful. And so that would be